My name is Dr. Lorraine Dickey, and I am the founder and CEO of the Narrative Initiative. At the Narrative Initiative, we use the stories of healthcare professionals to improve the experience of giving care by staff and the experience of receiving care by patients. I want to take a few minutes to tell you my story and why we do what we do at the Narrative Initiative. I was one of those kids who everyone said was smart. You can do anything you put your mind to. I graduated from the Air Force Academy, and I went directly to medical school. When I left the military, I joined a practice in Colorado and was rapidly on course to become the medical director by the time I turned 40. But on March 18, 2001, I suffered a catastrophic ski accident that should have killed me. I lost everything I had worked for in a split second. This was the kind of accident where I had to learn to walk again, I had to learn to read, I had a significant head injury along with a neck injury. And I was told by my medical team I'd probably be able to get back to work in 3 months. 3 months turned into 6 months, and the extent of my head injury became more evident. 6 months turned into 18 months, and my practice told me they had to fill my position. I lost my job, I lost my health insurance, and I felt I lost my identity. I was married, and we had 3 young teenagers who were not taking this well. However, I am probably a lot like you. I don't like taking no for an answer. In fact, my husband will tell you the surest way of getting me to do something is to tell me I can't do it. So with a lot of help, I was able to return to practicing as a physician 3 years later. I became a medical director within a year and went on to become the chief of the division. Now, I tell you this story not to pat myself on the back, but as a way of telling that I learned a few things after falling down that mountain. First, I learned it is a privilege to stand with patients and their families at times of great crisis and at times of great joy. I learned that when you diagnose one person with an injury or illness, you diagnose their whole family with that injury or illness. And I also learned that as a physician, the technical expertise I bring to my patients and their families is simply not enough. They need to leave feeling cared for. When I had the privilege of returning to medicine, I came back with a different mission. I had some good experiences as a patient, but I also had many that were terrible. I wanted to transform the experience of care for the better. I was introduced to the philosophy of patient and family-centered care in 2005, and this became my platform for policy change as a medical director and chief. It's been said that patients don't necessarily remember what you said or what you did for them, but they always remember how they made you feel. And I learned this firsthand. I was hospitalized in the hospital where I worked, and I was well known. I have a large gap in my memory around this time, but I remember one thing that happened, mostly because I remember how it made me feel. I was just out of the ICU, and I needed a shower. Someone, a nurse, an LPN, someone had to get me out of bed to the shower. I know the left side of my body wasn't working well, neither was my mind. I remember her helping me get undressed and sit on the bench in the shower. And I remember her just staying with me, kneeling beside me as I cried and cried. I felt she saw me not as a damaged physician, but as a wounded human being in need of compassion. And I'll never forget how that made me feel. It made me feel cared for. So now, I'm on a mission to improve the experience of care for those who need to receive care, our patients. But I've learned in order to do this, we also have to improve the experience of giving care for our healthcare staff too. When we implemented patient and family-centered care in my unit, initially it went quite well. However, about 6 months into this, my staff came to me and said, "Dr. Dickey, we're done with this. We can't take having patients and families around 24/7. We can't take giving report in front of family members. We're done." Well, we weren't done. But clearly there were challenges we needed to address. Like any good director, I got a committee together to figure this out. One of the many ways we tried to address this issue was to bring in an adaptation of the narrative medicine model pioneered by Dr. Rita Sharon at Columbia. We found by giving our frontline staff an opportunity to write a short story about the challenging and the uplifting experiences they have caring for patients and families, we could identify barriers and fundamental gaps in what patients and staff expected. And it worked. We were able to implement practical solutions. And we found out some other interesting things along the way. We found out by sharing these short stories, staff began to relate to each other based on story instead of by position. We found new team members and embedded quickly. Instead of having to wait to see how a new provider would behave in a critical situation, we could learn a lot about them through the stories they told or how they reflected on stories told by others. Trust came more quickly. Bullying decreased, and the tone in the unit became more civil. Morale improved. And staff members from all professions said they liked this, and they wanted to do more of it. So I tell you this because I want you to know our innovative narrative approach to challenging issues in the healthcare workplace is not just another good idea. It was born from a real clinical need to address a real clinical problem. Since 2005, we have been conducting and publishing research. In 2017, I started the Narrative Initiative to bring this very practical solution to other healthcare leaders and organizations who have similar issues, caring for patients and families and staff. If you or your organization are interested in improving the experience of healthcare, in improving the experience of feeling cared for, then schedule a call with us. We can help. We look forward to hearing from you.